Chapter 12, we will discuss fluids and minerals that are required for oral soft tissues as well as salivary glands. Water, as you guys know, is the most abundant component in the body. It's also the most important macronutrient because of that. It makes up 75 to 80% of our body weight at birth, and in an adult, it makes up 50 to 60% of our body weight. The body fluids are distributed either intracellular fluid within the cells or extracellular, which is all of the areas around the cells in our blood, things like that. Osmotic pressure equalizes the solute concentration between our intracellular and extracellular fluids. Here's an image that kind of shows you where extracellular fluids are found. In blood fluids, those interstitial fluids around cells, and then intracellular fluid is exactly what it states. It is inside of each cell. The roles of water are it can act as a solvent, which enables reactions to occur. It maintains the stability of all of our body fluids. It helps in the transport of our nutrients to the cells. It is a lubricant between our cells to prevent friction, and it also is very important in regulating our body temperature. It can evaporate as perspiration from the skin, which can help cool us, or vapor from the mouth and nose. A few days without water can be fatal. We can go without food longer than we can go without water. I do want you to know the recommended daily amount, or the average adequate intake for men is 3.7 liters a day, which is equal to about 15 to 16 cups per day. Women is 2.7 liters, which is 11 to 12 cups per day. Water is lost through urination, perspiration, expiration, and defecation. Only 100 to 200 milliliters of water is actually lost daily in fecal matter. As you know, a lot of that water is absorbed in the large intestine, so by the time it reaches exit, there's not much water left. If 2% or more of our water is lost, we have osmoreceptors in our body that are stimulated, and they will create that desire of thirst. So it'll tell us to be thirsty and ingest fluids, which increases the release of the anti-diuretic hormone. A diuretic is something that helps us get rid of excess water. So if it's an anti-diuretic, it's telling that body to hold on to all of its fluid, retain that fluid, and it will automatically decrease our urinary output and things such as that. If we have a decrease in blood pressure, these osmoreceptors will stimulate the release of the enzyme renin, which will increase the release of aldosterone. The aldosterone will result in sodium retention and water by the kidneys, and excretion of potassium and hydrogen ions, which then causes our blood pressure to increase. So all of those work together to help maintain that water balance as well as our blood pressure. This image is in your book. I like this because it's kind of showing if you take in a certain amount, and for instance 1,650 milliliters were consumed in a beverage, and then 750 were in foods, and then you'll see our output through respiration. 400 milliliters were given off, skin through perspiration 500, kidneys through urine was 1,700, and fecal matter was 150. So our intake equaled our output in this particular example. No digestion is necessary for water to be absorbed. It is transported in our body by osmosis, and within 1 hour, 1 liter, which if you think about a 2-liter bottle of like pop, half of that can be absorbed from the small intestine in an hour. Normally, almost all fluid is absorbed, with only a small amount, like we stated, is excreted in the fecal matter. Sources for water are It is the only liquid nutrient that is essential for body hydration, and plain tap water is the most natural source. 30 to 34% of fluid intake comes from our water, and the Environmental Protection Agency, or the EPA, are the ones that regulate the levels of contaminants in our water and public water systems. So they're the ones that assure that our water is safe to drink. Use of bottled water has increased. The one thing for us to consider with those that are on bottled water is there's no fluoride in bottled water. So sometimes that needs to be addressed depending on if they live in an area that has fluoridated water or not. Coffees and teas are the #1 beverage consumed at home, and the U.S. Food and Drug Administration continues to investigate the amount of caffeine that is safe for human consumption. Soft drinks is another source of fluid. It's not the best source. Many of our beverages are sugar sweetened, which can contribute to decay as well as added sugar intake. Many times those that are overweight, if you just look at their beverage consumption and reduce all of their beverages to a no-calorie choice, it can make a big difference because it contributes 47% of our added sugar intake. Approximately 50% of the increase in calories intake over the past 20 years is due to sugary drinks. Energy drinks is a big thing now. Sales on energy drinks have doubled in just the last 5 years, and they are marketed as an ergogenic to delay fatigue. They contain caffeine, guarana, and taurine, which are all supposed to contribute to energy as well as helping with fatigue. Energy drinks usually contain about 140 calories per 8-ounce serving, so again, very high in calories. Sports drinks, a lot of people drink these sport drinks. They are designed for highly trained endurance athletes who exercise at a high intensity for long periods of time. So unless you're really working out heavily and hard, sports drinks aren't a necessity. If you just go for a long walk, water is probably a better way to rehydrate yourself. When I did the 3-day 60-mile walk for breast cancer, they had different stations. You'd walk for a while and there'd be a station, and they would recommend that you did not drink those sports drinks at every station, that you rotated because you don't need that much. So, and many times they do have a lot of calories, so it's kind of unnecessary. Erosion is a problem that can happen from some of these drinks. Many of the sports and energy drinks have a pH way in the acidic range. Down 3 to 4 is the pH, so 7 is neutral, and anything below 5.5 can be carcinogenic. So it's very important to be aware of that. They are adding calcium to some of these sports drinks to help lessen that erosive potential to the teeth. Enamel erosion with various beverages can occur in the order listed on this slide from greatest to least. So the greatest risk for erosion to the teeth would come from your energy drinks, then your sports drinks, then regular soda, then diet soda. And yes, even diet soda can cause breakdown of the tooth structure due to the acids that are found in the soda. It doesn't have sugar, but it does have carbonic acid and I believe phosphoric acid. So even diet sodas can cause decay. Hyperstates of water intake can lead to a fluid volume excess, and this will occur in the extracellular fluid compartments, which would be secondary to an increase in total body sodium. This could cause weight gain, puffy eyelids, the distension of those vessels in the neck, and high blood pressure. So people that might be at risk of this are patients suffering with congestive heart failure, chronic renal failure, possibly chronic liver disease, and high levels of steroids. Low states of fluid intake would be a fluid volume deficit, which would be the opposite, associated with excessive loss of fluids, which could be from a GI tract problem. Maybe they're having excessive vomiting, diarrhea, drainage tubes for whatever reason. Maybe they have urinary tract issues, they're on diuretics, they have polyuria or excessive urination. Excessive sweating from the skin could lead to a fluid volume deficit. Signs of this would be that dry tongue with fissures, dry mouth, shrinkage of the oral mucous membranes, decreased skin turgor, which is elasticity of the skin, dry skin, and a decreased urinary output. If fluid volume deficit is mild, oral fluids can be sufficient. IV solutions are needed if the patient is significantly dehydrated. Electrolytes are compounds or ions that will break apart in solutions. So a cation has a positive charge. So some of the cations that we find in our body are sodium, potassium, calcium, and magnesium. The principal cation in our plasma and our interstitial fluids is sodium. An anion has a negative charge, so chloride, bicarbonate, and phosphate, and the principal anion in plasma and interstitial fluid is chloride. They are important in the balance, the acid-base balance in our body. Sodium's purpose is to maintain our normal extracellular concentration. It can affect the concentration, the excretion, and absorption of potassium and chloride, as well as our water distribution. Sodium also regulates that acid-base balance and can facilitate our impulse transmission in nerve and muscle fibers. There is no recommended dietary allowance for sodium. We know a safe minimum intake is 500 milligrams a day. Adequate intake is 1,500 milligrams a day. And upper limit is 2,300. We'd like to stay 2,300 or less with our sodium intake. Unfortunately, in America, the average daily consumption of salt is 3,400. And approximately a third of Americans have high blood pressure, which again, they would be put on a low sodium diet due to that acid balance and water control. Studies agree that reducing our salt reduces blood pressure in individuals with high blood pressure. So many of your patients are going to be on a low sodium diet. For us, this comes into play if you were using a ProfiJet, because many of the ProfiJet powders are sodium bicarbonate. So you might want to use a powder that does not contain sodium on a high blood pressure patient. And also you could help them with diet if they're struggling with how to decrease sodium in their day. You could help them. Some of the sources of sodium that we have in the United States are our meat, eggs, dairy, and even some vegetables. 10% of sodium consumed comes from the natural content of our foods or beverages. Even a diet soda has got sodium. So if you start looking at labels, there's sodium literally in about everything. But 75% to 80% of sodium consumed in the United States is due to our processed foods. If you go to restaurants, there's a huge amount of sodium in foods prepared in restaurants, and especially fast food. This is just a picture that I like that gives you that example. I mean, this is just an average sandwich with turkey. The bread itself has 200 milligrams. One leaf of lettuce even has 2 milligrams. Slice of cheese, 310. A teaspoon of mustard, 120 milligrams. 6 thin slices of turkey is almost 700 milligrams of sodium. And then your other piece of bread is 200. So that's a total of over 1,500 just for that one sandwich. So you can see how sodium can add up quickly in our diet. Hyperstates of sodium would be called hypernatremia. And this could result in extreme thirst, that dry, sticky tongue, fever, convulsions. Low states of sodium would be called hyponatremia. Water intoxication or hyponatremia can occur when individuals drink too much water, can cause nausea and cramps, headache, confusion, lethargy, and in a severe case, a coma. And this is just that fissured, dry tongue from too much salt. The requirements of chloride. Chloride maintains the extracellular fluid balance, the osmotic equilibrium, as well as electrolyte balance. Requirements for chloride are the same as sodium, 23 milligrams a day or below. Sources, again, salt, because sodium chloride is table salt. Toxicity can be caused by excessive intakes of salt, which can result in dehydration, renal failure. Cushing syndrome is another factor. Potassium. Potassium is important in intracellular fluid concentration. It affects muscle contraction, especially our heart, because our heart is our biggest muscle, and potassium can definitely affect the electrical conductivity of the heart. It affects transmission of nerve impulses and helps to regulate that acid-base balance. The upper limit for potassium is 4,700 milligrams a day for all adults. And potassium is very, very important for heart function. Approximately 92% of ingested potassium is excreted in the urine. Sources are dairy, meat, grains, fruits, vegetables, processed foods, supplements, and salt substitutes contain potassium, but 31% of our total dietary potassium comes from that dairy, meat, and grain group. Hyperkalemia, which is an elevated serum potassium, can be life-threatening due to cardiac arrest. It will lead to impaired renal function, an increased shift of potassium out of the cells, and increased potassium intake. So treatment with this would involve potassium restriction or using medications to actually remove potassium from the patient's body. Hypokalemia would be the opposite, and things such as diuretics, Cushing syndrome, hyperaldosteronism, hypomagnesemia, and alcoholism can all lead to low potassium levels. And potassium is the major intracellular cation. Deficits could affect every body system. Iron is a component of hemoglobin. It catalyzes many of our oxidative reactions within our cells. It's important in the conversion of beta-carotene to vitamin A. Beta-carotene is that component of vitamin A in a plant. It is important in the formation of purines as part of nucleic acid, which is our DNA, RNA. Removal of lipids from the blood. It is important in the detoxification of drugs in the liver, the synthesis of collagen, as well as production of our antibodies for our immune defense. You'll want to know the requirements for iron for men and post-menopausal women is 8 milligrams a day. However, for women from the ages of 19 to 50, they recommend 18 milligrams a day due to blood loss during menstruation. Upper limit of 45 milligrams a day on iron. Iron is poorly absorbed. It binds to the serum protein transferrin, which functions to recycle our iron. Absorption of heme iron will parallel the body's needs. Heme iron is that iron gained from animal, like liver, things like that. Absorption of non-heme iron would depend on the intraluminal composition or meal composition, as well as the need. So non-heme iron comes from plant sources. And these are the different factors that affect absorption of iron. Increased fiber can affect it. tannins that are found in beverages and foods, tissue saturation, if they have a malabsorption issue, etc. These are all things that can affect our body's ability to absorb that iron. Iron is probably the most difficult mineral to obtain in adequate amounts in the American diet. So that's why a lot of things are iron fortified, and many people take iron supplementation. One of the drawbacks to iron supplementation is it can lead to constipation for many patients. Hyperstates of iron are hemochromatosis. Organ damage can be a result of a high state or toxicity of iron. Coronary heart disease. We can see skin pigmentation and cirrhosis of the liver. All of these are because the body cannot easily eliminate excess iron, and so that's why iron absorption rates are poor. If you're deficient in iron, it leads to anemia, iron deficiency anemia, which would present itself with microcytic anemia, which would be small blood cells, immature small blood cells, that angular chelosis that we see, pale lips and gingiva, a sore burning tongue, and glossitis, again, atrophy of the filiform papillae. They are at risk for candidiasis, and possibly an increased caries susceptibility. Oral candidiasis and a reduced resistance to infection are frequently associated with iron deficiency. Zinc is another mineral that we're going to talk about. It's a component in over 300 enzymes that affect growth and replication, so DNA and RNA. It plays a role in collagen production, bone resorption and remodeling. It is important in sexual maturation, night vision, our immunity, and taste, smell, and appetite are impacted by zinc. The bioavailability of zinc can vary. Approximately 25 to 40% of dietary zinc is absorbed, and some is lost in fecal material. Sources are lamb, beef, crustaceans, especially oysters, eggs, and peanuts all provide zinc. High levels of zinc could cause vomiting, diarrhea, lethargy, renal damage, pancreatitis, and death in severe cases. Excess of zinc can reduce our copper status. It can alter our iron function and decrease immune function. And excess zinc can decrease high-density lipoproteins. Low states of zinc can lead to some issues with epithelial tissues, thickening, increased susceptibility, therefore, to periodontal disease, flattening of our filiform papillae, loss of taste and smell acuity, possibly a poor appetite, and impaired wound healing. Some of the groups that might be at risk for that would be our older adults, vegans, or those with severe malabsorption or chronic health problems. Iodine, I always remember that iodine is associated with the thyroid because it is very important in the production of thyroxine, which is that thyroid hormone. So thyroxine regulates our basal metabolic rate and is essential for normal brain development. Iodine recommended daily amount is 150 micrograms per day, and typically iodine in the American diet is adequate. All of ours, not all of our salts, but most of our table salt is iodized, so that's where many of us get our iodine. Iodine levels for pregnant and breastfeeding women are less than desirable. Sources would be seafood, plants grown near the ocean will contain natural iodine, molasses, yogurt, milk, and again, that iodized salt is where typically we get most of ours. If a person is high, has high levels of iodine, it can result in thyroiditis, hypothyroidism, or hyper, depending on the patient. and sensitivity reactions can occur from too much iodine. Low states could result in goiter, which is an enlargement of that thyroid gland, spontaneous abortions in women that are pregnant with possibly congenital anomalies as well. We see delayed eruption of primary and secondary teeth, an enlarged tongue, and endemic cretinism. And this is what a goiter might look like in a patient that has iodine deficiency.